Welcome back. If you are new here, I'm Chris and I'm a medical doctor and PhD candidate in epidemiology. And I'm also helping the healthcare professionals to relocate to other countries. And we have our own website, globaljob4you.info. We post a lot of global healthcare vacancy for medical doctors, nurses, and alliance healthcare workers, and also for the health-related research positions and academic positions. And we will shortly launch our interview Q&A app, and you can have a one-stop service in our websites. Today in this video, I'm going to share you how to work as a medical officer or general practitioner in Bahrain. Bahrain is one of the Gulf countries located between the Qatar and Saudi Arabia. And most of the Gulf country verification process and registration process are almost the same. But here is a little bit different and less stricter than other countries like UAE and Qatar. So let's get into it. The first step is check your medical degree recognitions. Ensure your MBBS or MD is eligible for the license, and your medical school is recognized by the National Health Regulatory Authorities, and it should be or it must be listed in the WHO World Directories. And another step is the primary source of verifications. National Health Regulatory Authority verifies your documents are authentic, and you can apply through the data flow process with online portal. And what are the required documents for these verifications? Your primary medical degree and your transcript and internship certificates, and your home country medical license and work experience letters. So it can take about 4 to 6 weeks, and the verifications fees must be $300 to $500. It depends on what type of package, what type of documents you are selected. And after that, National Health Regulatory Authority will issue the verifications report to you. The registrations process is a bit different from the DHA process. After passing your promotory exam, you can apply your registrations, but here is different. You have to land a job first, and your employer will sponsor your employment and work visa. And you have to apply to Bahrain hospitals or clinics licensed by National Health Regulatory Authority, and you will get your employment offers or contracts, and employer will provide you sponsorship for work visas and residency permits. In here, you have your target should be private hospital. They often hire IMG faster, and public hospital prioritize their nationalities. And if you got a job offers and your employers are working your work permits and visa process, you can your medical check, you must go the medical check, including chest x-ray, TB screenings, HIV tests, hepatitis B and C, and general fitness exam. The visa process can take 2 to 6 weeks, and after approval, you can receive the residency permit and CPR card. And now you can work as a medical officer or general practitioner in Bahrain. So what the timeline, estimate timeline you have to know before preparing these documents. If you have all required documents in your hand, for the primary source of verifications, it can take 4 to 8 weeks, and National Health Regulatory Authority applications review can take 2 to 4 weeks, and your licensing exam schedulings and preparations can take 4 to 8 weeks, and job offers and visa can take a bit longer. It depends on your background experience and your strategies to find a job. So generally it can take 2 to 6 weeks, and your licensing process is 1 to 2 weeks after exam and after getting a job contract. So here is the very practical tips and clear step-by-step to work as a medical officer and general practitioners in Bahrain, and see you in my next video.